Assalamu alaikum. Greetings from our channel Beginners Made Learning. In the previous lecture video, we have discussed about the introduction of female reproductive anatomy. Today, we will discuss about the uterus in brief. So let's start to our today's topic. What is the learning content of today's lecture video? This include gross anatomy, relation of the uterus with other organ, the histology of the uterus, blood supply, lymphatic drainage, nerve supply, and support of the uterus. At the end of this video lecture, we will able to learn about this content. First of all, uterus. It has many names, so we will learn about the synonyms. In Latin, it is known as uterus. In Greek, it is called hystera, and in English, it is called womb. It is a pear or piriformis shaped organ. It is a hollow, thick-walled muscular organ with a narrow lumen. What is the size and weight of the uterus? Different author gives different size and weight according to that thesis, and we will able to learn about the different sizes of the uterus. In length, some authors says it about 8 centimeter and some says it's about 7.5 centimeter. Breadth is 5 centimeter at fundus and thickness is 1.25 centimeter and some says 2.5 centimeter. In weight, about 50 to 80 gram in reproductive age, or you can say 30 to 40 gram. Both are correct. At birth, the weight is minimum, it is 2 gram. During pregnancy, the size of the uterus enlarge and hypertrophy and hyperplasia occur. That's why during pregnancy, it is about 1 kg. Okay, now the parts of the uterus. It is mainly divided into 3 parts. One is body, another is isthmus, and lower portion is cervix. Now from the figure, we may know that this is the body. This is cervix and this portion is isthmus. Okay, the body is also called or known as corpus. The upper two-thirds of the uterus is known as body or corpus, and lowermost one-third is known as cervix, and the junction between upper two-thirds and lower one-third, marked by circular constriction, is known as isthmus. Now the body. Body again divided into 3 parts. One is fundus and the body proper, and a small portion cornu. The fundus, the upper extended dome-like end of the body is known as fundus. It is situated above imaginary line or plane passing through the opening of the fallopian tube. Okay, from figure we may know that this is fallopian tube opening, an imaginary plane. The upper portion is known as fundus. Okay, then the body proper, it is triangular shape. It lies between the opening of fallopian tube and isthmus. These are the opening of the tube, and up to the isthmus it is known as body proper. And the cornu, it is the junction between body and the uterine tube opening. This portion is known as cornu. Now the isthmus. Isthmus is annular shaped in nulliparous. Its length is about 0.1 to 0.5 centimeter. It lies between anatomical internal os to histological internal os. It has an importance that in many obstetricians give the importance of this isthmus because it forms the lower uterine segment during labor procedure. Okay, now we from figure we know that we may learn that It is the anatomical This is the anatomical internal os, and it is the histological internal os, and the area between this os is known as isthmus. Okay, the next slide. Cervix. Cervix is an important because it is the exits of the uterine body and the lowermost part. It is a cylindrical part of the uterus. Cervical canal is fusiform shaped. Extension. From histological internal os to external os, it opens into the anterior wall of the vagina. Shape is cylindrical in nulliparous and size is about 2.5 cm in length and breadth is 2.5 cm. Cervix has two parts, one is supravaginal and other is vaginal part. The anterior wall of vagina, the supravaginal part is enter up to the anterior wall of the vagina. Okay. This is the histological part of the internal os, and this is the exit or external os. The area between this is known as cervix, and it has two parts. One is supravaginal part and vaginal part. Up to the beginning of the vagina, this part is supravaginal, and this part is known as vaginal part. Now, one important topic is the position. Uterus doesn't lie longitudinally, it lies obliquely, and it's form an angle with the cervix and with the vaginal canal. So for the normal uterus, the position is anteversion and anteflexion. Now we will learn that what is anteversion. Angle between long axis of the vagina and long axis of the cervix is known as anteversion position. It forms a angle about 90 degree. And anteflexion is the angle between the long axis of cervix and long axis of the body of the uterus. It forms 170 degree, and some authors says it forms 120 degree. From here, we know that this is the long axis of the vagina and this is the long axis of the cervix, and it forms an angle about 90 degree. It is the anteversion position, and another is anteflexion, that is the long axis of the cervix and the long axis of the uterine body, that form about 170 degree angle, and it is the normal position of the uterus. And for easy remember, you may remember this version B for vagina, and cervix is common in both anteversion and anteflexion position. Okay. Now the important topics, that is relation of the uterus with anterior, posterior and lateral surfaces, and what are the organ lies anteriorly, what are the organ lies posteriorly and laterally to the uterus. We may learn from this slide about this. Okay. Anteriorly, the body of the uterus is related to the uterovesical pouch and the superior surface of the uterine body. The supravaginal portion of the cervix also related to the posterior surface of the urinary bladder. The vaginal portion of the cervix is related to the anterior fornix of the vagina. And posteriorly, the body of the uterus is related to the uterine pouch with coils of ileum and sigmoid colon in it. The supravaginal portion of the cervix is related to the rectuterine pouch with coils of ileum and sigmoid colon in it. The vaginal portion of the cervix is related to posterior fornix. And laterally, the body of the uterus is related to the broad ligament and uterine artery and vein. This figure shows the broad ligament. This is the uterine artery and the uterine vein. The supravaginal portion of the cervix is related to the ureter and uterine artery. This is the ureter, this is the uterine artery. The vaginal portion of the cervix is related to the lateral fornices of the vagina. This is the vaginal portion of cervix, and these are the lateral fornices of the vagina. Now we will know about the histology of the uterus. Okay, it has three layers from outer to inner. These are the perimetrium, myometrium, and endometrium. This outer covering is known as perimetrium. The middlemost is myometrium, this is muscle layer, and the innermost is endometrium. Metra is another name of the uterus. From that, it is called perimetrium, myometrium, and endometrium. Okay, now we learn about the perimetrium. It is peritoneal covering of the uterus derived from the broad ligament. Myometrium is the thickest layer and consists of compactly arranged smooth muscle bundle. Okay, from outer to inner, the muscle layer, outer longitudinal layer, middle oblique or interlacing layer, and the inner circular layer. The function of the myometrial smooth muscle are very much important because the outer longitudinal layer helps to expulsion of the written product of conception. Middle layer is most important because this interlacing layer during the parturition they remain in crisscross manner and they contract and the vessel stop bleeding and it acts as a living ligature and they stop bleeding after parturition. And the inner circular layer the from the sphincter and helps to retain the product of conception. Next, endometrium. It is the mucosal lining of the body of the uterus. It has functionally two layers, outer basal layer and inner functional layer. In outer basal layer is permanent and it helps to regeneration of endothelium. And inner functional layer is shows cyclical change and shedding out during its menstrual cycle. And the lining epithelium of the endometrium is ciliated columnar epithelium. Blood supply. Okay, blood supply is divided into arterial supply and venous drainage. First of all, we will know about the arterial supply. Arterial supply is derived from the pair of uterine artery, the branches of anterior division of internal artery. Now we will learn about the internal arterial supply of the uterus. It's also a complex, forming a complex branches of artery. It gives the arterial supply to the uterus. First of all, uterine artery of both sides, anastomosis, the anterior and posterior surface of the body in the midline. And after anastomosing, they give rises to radial artery that arises from arcuate artery. And this radial artery pairs the myometrium centipetally and anastomoses each other to form stratum vasculare. This is the stratum vasculare in the middle of the muscular coat. Okay, then this stratum vasculare gives two sets of arterial artery, that is basal and spiral branches. Basal branches, it is the basal and this is the spiral branches. Basal branches gives blood supply, arterial supply to the stratum basale, the outer basal layer, and the spiral artery give the functional layer supply, and this functional layer shedding out during menstrual cycle along with spiral artery. Blood supply. Next, the venous drainage. The veins of the uterus correspond to the arteries. They form the venous plexus along the lateral border along the lateral border of the uterus, which drains into the internal iliac artery vein and through the uterine and vaginal vein. And thus, balanced drainage occur. Now, lymphatic drainage is an important to know because the lymphatic drainage is the lymphatic route is the one of the most common route to spread of cancer from cervix and endometrium. So, we have to learn about the uterus lymphatic drainage. Okay, from fundus and the upper part of the body drain into the pre and para-aortic lymph node along the ovarian vessel. However, a few lymphatic vessels from the lateral angle of the uterus drain into superficial inguinal lymph node along the round ligament of the uterus. Next, from the lower part of the body, the lymph vessel along the external drain into the external iliac lymph node via the broad ligament. From cervix, on each side of the lymph vessel drain into the three direction. Laterally, the lymph vessel drain into the external iliac and obturator node by passing parametric node tissue. Few of these vessels are intercepted by paracervical node. Laterally, the lymph vessel drain into the internal iliac node by passing along the uterine vessel. And posteriorly, the lymph vessel drained into sacral node by passing along the uterosacral ligament. Now the nerve supply of the uterus. It has abundant sympathetic and parasympathetic supply. Sympathetic motor is thoracic 5 to thoracic 6 and for sensory lumbar 10 lumbar 1 from thoracic 10. And parasympathetic supply is derived from sacral 1, 2 and 3 and via the pelvic splanchnic nerve it gives the parasympathetic supply to the uterus. Last but not least, our topic is support of the uterus. Uterus have to maintain its normal position through some primary support and some secondary support. This support system makes the uterus in its normal position. Now we will know about the primary support. What are the primary support? We can divide it into three. One is muscular, and that is visceral, and is fibromuscular. Muscular support of the uterus is first of all pelvic diaphragm, perineal body, and urogenital diaphragm. Visceral support is given by urinary bladder, vagina, and axis of the uterus. This is the bladder, this is the vagina, and this is the axis of the uterus. Okay, next is fibromuscular. Fibromuscular, the most important and common support is transverse cervical ligament. This is the transverse cervical ligament. This is the cervix. Okay, this transverse cervical ligament is also known as McEnroe's ligament, and it is the strongest ligament that supports the uterus. Next one is pivocervical ligament. That is pivocervical ligament. Another one is uterosacral ligament. That is uterosacral ligament. That is the another support of the uterus. And the last one is round ligament of the uterus. This remain in this portion. Okay. Now the secondary support. One is broad ligament. That's covering the anterior and posterior surface of the uterus, but not the lateral border. And uterovesical fold of the peritoneum. This is the uterovesical fold of the peritoneum and the rectovaginal fold. This is the rectum, which is the vagina, rectovaginal fold. This gives the secondary support of the uterus to maintain its normal position. Okay, so we now learn about the gross anatomy, about the position, relationship, blood supply, lymphatic drainage, nerve supply, and the rest support of the uterus. Okay, this is in short about the uterus. We will learn about the external genital organ in our next video. Stay tuned, keep learning, and spread your knowledge to others. Thank you.